managing the complex resident has to be a multifaceted approach. It is not the resident care department. It is not the special care unit director that manages it. You need all hands on deck and all eyes on deck. And that begins truly with, I have this kind of the circle of life in many respects. It begins with speaking to your team, hosting weekly caregiver meetings. Talk with the team. Talk with your front line. Your housekeepers know what's going on. They're seeing changes in the resident's environment. Your food servers in the dining room, what are they eating? What are they not eating? Are they not eating at all and just going to dessert? Talk to your nurses' aides. What are they seeing? As we know, they're the first ones to report significant changes in condition, but it's the small things, it's the subtle cues that we need to empower the team to be able to bring forth and not assume that it's just an oh well situation. So one, it starts from there. From that information, from when you garnish key points from that talk, then you're identifying them. Your radar is up. These are, again, the triggers that an ounce of prevention is the pound of cure in the end. You're logging them down. You're then taking those residents, the names that you heard, the concerns that you heard, and you're partnering with the outside services and partnering, again, with your team members in your community to gain success. And as you can see, it's a continuous circle. The following slide, actually, I've identified for you some potential tools to be able to kind of archive a little bit. So when I referenced earlier kind of weekly caregiver meetings, bringing your teams together, here you have the managing the acuity tool or a tracking report. You're including, this is your to-do list, and your resident's name, kind of their apartment for your identifiers. You're identifying what was reported to you. What was that subtle piece of information that intuitively your heart of hearts kind of says, wait a minute, I need to do and investigate that. The key to success is putting accountability around it. Who's going to own it? What and when are they going to be identified? And what will be the follow-up? That's very key. A lot of times we just talk, and then the incident occurs, the situation occurs, and now we have a crisis. So this is, again, preemptive, a tool that could be used preemptively to try to get and support the resident before, as I said, a crisis kind of occurs. So this is your working tool. This is kind of put it on a clipboard, hang it out so, again, the responsible people can update it and so forth. For a communication to all the teams, I've attached the following slide and the following tool for you to use. From that tracking report, pull out or highlight kind of the key things. This tool that you have in here is really to be spread interdepartmentally. This is where you reach out to your fellow team members on a department head level and say, listen, I have Joe, Susie, Frank identified. I need your pair of eyes. This, again, just to reemphasize, this is not a resident care department. This is everybody's department. Sales, plan ops, business, everybody works. And everybody, as you know, in our communities, we don't have very many levels. We don't have a lot of hands. We need to truly work in a unified fashion to be able to gain success. And so putting this down, what interventions we are in place, empowers and also postures you in a position of knowledge so that when you're conversing with the families, you're telling them and showing them that you're a true partner in ensuring the success of the residency of your resident. So you're putting why, you've identified them. It could be an at-risk reason, could be false. An at-risk reason could be dissatisfaction. You've heard some increase in complaints. That could be an at-risk reason of someone, again, in an acute situation. You could put an at-risk, really appetite declining. Again, all these are all things. A new move-in is also can be a very complex reason and could, again, warrant that you keep your eyes to ensure there's successful acclimation and that we've truly met their service plan requirements up front to be able to kind of stabilize them within your community. What we're doing about it, the visits. These are folks in a sense of if you've got a complex resident who is out of your building and in a skilled environment or in an acute hospital situation, to kind of keep your team aware. Have you gone out to visit them? Have you made contact with the social service department or the unit manager of that place to say, this is my resident, I'm invested in their success and want to be part of their care here so that the transition back to the community will be as positive as possible. Obviously, in your comments, you're writing that, and then you're keeping a log, your dates. It's just a running tool. There's got to be a person who owns this. Sometimes it's the executive director. Sometimes it's the resident care director. But they're the person to be able to archive this. At the end of the day, this is actually a move-out management tool. Because, again, you're managing the complex resident. You're trying to maintain their success in your community. And this is one intervention that I offer you today that for us has been very, very proven to be successful. What we've done moving forward is in our presentation today, we're actually going to present to you a case example. And in this example, I've partnered with both Janet and Marianne, and we created a resident a little bit based on truly a case example, but I threw at them as an assisted living provider as much complexity as I could. We threw in some dementia, we threw in some insulin, we threw in all kinds of things that we know day to day that helps us manage. In this presentation, I ask that you keep one thing in your mind. This is the absolute ideal approach to the management of care. We wanted to present to you all today exactly what is out there for a third-party service provider, the elite of the elite. And in that, if you yourself and you're evaluating your partnerships with your ancillary services and you're gaining anything less, then as advocates for our customers, our residents, decisions or information, if you use this handout today as a tool to present and says, I know that this can be done. I know insurances or services are available. Can you do it or can't you? And then, work with the resident and their family to be able to then make the right choices around providers. So again, the feedback has been, we've presented this before, that we were living a little bit in a dream world. But again, this is, to empower you and to make you aware truly of what the tools are available in our community to help manage our complex residents.